Good evening, ladies and gentlemen. Thank you for being here this evening. We appreciate you. Thank you to Josh and Ernie's Barbecue for serving us the delicious food, and Rose and Lisa, thank you. I do hope that you enjoyed your dinner. Thank you to Friendly News for being here to broadcast on Facebook. This presentation is being shown live and recorded. If you'd like to view it later and share it, please do so. We want to thank the GO2 Foundation for providing the information on the table, as well as the keychain lights and the armbands. Thank you to everyone attending tonight. We hope that you find this information insightful and helpful for your health. A special thank you to, on my far right, Dr. Sarah Lay with Hunt Regional Medical Partners Family Practice at Westlake. And then to my left here, it's still my right, but the far left of the stage. Dr. Mohan Phillip with Greenville Pulmonary Associates. We have on the ladies' side, Dr. Mira Shradara from Texas Oncology. And on the men's side, inside, we have Dr. Sanjay Amandi at the Lou and Jack Finney Cancer Center that's located at Hunt Regional Medical Center. We want to thank you guys so much for being here. We know you're giving up family time to do this, and we appreciate it. So thank you for sharing your knowledge and expertise. We will be asking predetermined questions that will give us an overview of lung health, and since it is Cancer Awareness Month, we will be shining a light on that topic as well. We will not take specific questions from the audience, and this is to protect against patient confidentiality because we are broadcasting this event. So thank you again for attending, and we're going to get started. Dr. Lay, as a primary care physician, what is one of the most important things that you need from your patients?
Can you hear me okay? I guess so. Well, I'm a family practitioner, and me now? Okay. I treat people from patients through old. I just had a patient who turned to health this past week, which was in our office. To know that
Sorry, guys. Testing one. Testing 1, 2. Testing 1, 2.
3, 4.
And then the other thing would probably just be that patients are very honest with us about their symptoms.
Dr. Lay, we're going to come back to you. I apologize. Dr. Phillip, we're going to try your mic. How's that? Are there jobs or environments that increase lung cancer risks?
Yes, so welders who have an increased risk of lung cancer have people who have been exposed to asbestos. That's not as common these days. People who used to work on as mechanics working with brakes and stuff were exposed to asbestos. People who work, who work for the armed forces, specifically the Navy, who worked at the shipyards where they may have been exposed to asbestos. There are some that are not so clear cut, but diesel exhaust has been known to be associated with lung cancer. A lot of plumbers who work with old buildings, some of the old heating tubes, pipes were coated with asbestos, so there's risk there. So those are some of the...
Working through some technical...
That's all right. So those are some of the risks with job-related.
Along those same lines, are there certain people, whether ethnicity, gender, who might be at higher risk, and are there people with certain conditions, COPD, emphysema, etc.?
So gender-wise, it's more to do with their smoking risk and exposure risk in jobs and stuff that increase their risk. Used to be was mainly a male problem to have lung cancer, but as time has gone on, more and more women are smoking, and therefore, whereas lung cancer in men are decreasing, overall lung cancer in women is actually increasing. Ethnicity, not so much. No definite link to an increased risk. Again, it's all smoking and exposure related. So what was the rest of the question?
Health concerns,
Okay.
COPD.
So definitely the COPD does have an increased risk of lung cancer, and that is not, it does not, that exclude, even if you discount the risk of smoking, just having COPD and emphysema does increase your risk of lung cancer. Idiopathic pulmonary fibrosis does increase your risk of lung cancer. Obviously, asbestos exposure and asbestosis increases your risk of lung cancer. That's most of it, predominantly what can increase your risk of lung cancer.
We're going to do one more question for you, and then we'll come back on another one to follow up. COVID, given what we know, and of course there's a lot that we don't know, those who have been tested positive, what can they do to build their lung health, and also people who may have seasonal allergies? Oh, let's try your mic.
So what can you do to improve lung health? There's nothing specific. It's like most other lung problems is getting back up on your feet, getting exercise, moving around, getting back on your feet and improving your conditioning. There's not a whole lot you can do to improve any lung injury there may be specifically. As far as seasonal allergies, if the question is what can you do to improve your lung, essentially not a whole lot except get your shots. If you are taking allergy shots, to get them regularly. Take your medications, specifically improving your lungs per se, not a whole lot. I mean, sometimes you can use your inhalers if you have some breathing issues, but bottom line, as far as the lungs and improving lung function, always comes down to getting your exercise, being active, and not, being a couch potato, obviously.
All those things we don't like to hear. But again, thank you for sharing that. We appreciate that. Dr. Lay, can we go back to you? As a primary care physician, what's the most important thing that you need from your patients?
I think the most important thing is that patients are honest with us about their symptoms. There are a lot of things that we can treat in primary care. So people who have mild asthma, even mild persistent asthma, emphysema, COPD, a lot of those things we can help them with. And if their symptoms are worsening and are flaring up, then the sooner we can see them, the sooner we can help them to get better and hopefully prevent them having to go to the emergency room or having to go to the hospital.
Thank you, Dr. Lay. Along those lines, when you're being honest about symptoms, what are some of those things that you need true honesty about?
Well, smoking, number one. A lot of people don't like to admit that they're smoking, or if they've quit smoking and then restarted, I know they're very reluctant sometimes to tell their doctors, but the more honest they can be with us, the better we can help them with those kind of habits. But I think just other symptoms in general, if somebody has a cough, congestion, a fever, I would rather know sooner than later, because the sooner I can see them, the better I can help them, rather than have it become a severe attack for them.
And keep those regular appointments.
Yes,
So
ma'am.
you're seen when you're healthy,
Yep.
not just when you're sick, right?
Absolutely.
Thank you, Dr. Lay. One more question. Of symptoms that you monitor in regarding to lung health, what are the ones that would prompt you possibly to send to a pulmonologist or for screening?
Well, I think screening, if we're talking lung cancer screening, it would mainly be a smoking history that I would be concerned about. I'm sorry, what was the first part?
What are symptoms that would prompt you to maybe possibly monitor versus sending for screening?
So one of the big red flags to me is if somebody coughs up blood. So when there's a cough with mucus production and there's blood in it, that's always more concerning to me. Sometimes that can be just from inflammation or a bad infection, but we always want to make sure there's not some sort of underlying cancer or malignancy. The other thing would be worsening symptoms. So if a patient is stable and they're doing well on their preventive medicines and their symptoms are well controlled, then that's something that we feel confident about following. On the other hand, if their symptoms are worsening and progressing, or maybe they're admitted to the hospital frequently, then that's time for us to look at a referral to Dr. Phillip or a pulmonologist for further evaluation.
Thank you. And these are to Dr. Mondi or Dr. Shardar. I believe you're going to tag team some of these. So are there certain health conditions that make one more vulnerable? Dr. Phillip talked about a lot of them, but what do you see in your office?
I can take that one. Dr. Phillips, pretty much most common conditions that are more predisposing for lung cancer. He talked about COPD or emphysema, which by far is the most common one. And I think it is more due to an association with cigarette smoking rather than the COPD itself. But he also mentioned about pulmonary fibrosis. A couple other not so common things that we really think about but can be associated with an increased lung cancer risk is certain forms of HPV viruses can increase the risk of mostly head and neck cancers, and by default, the way a lot of head and neck cancers work is they kind of colonize a whole field, and the lung can sometimes be part of that field. So we do see sometimes a higher risk of lung cancer in people that have had or exposed to high-risk HPV infections. HIV or any kind of compromised state is also a risk factor for a variety of cancers, lung cancers included. So those would be some of the conditions where we would be a little more observant in terms of detecting lung cancers.
Thank you.
Could you pull your mic just a little bit
Closer, okay. That's good.
Okay, and of the lung cancers, there are two major types. Can you describe those?
One is something called small cell lung cancer, and the other one is something called non-small cell lung cancer. As you can see, we oncologists are very creative. We figured out one was called small cell, and then we just decided to name the other one small cell. Basically, what is different between the two types is our small cell lung cancers are typically what we consider very aggressive, meaning they can grow very rapidly. They can go from being very small nodules to spreading widely across, lymph nodes and even other parts of your body very quickly. So that is why that is something we always want to be able to differentiate, because they are treated differently, they're approached differently, and how serious they can be is also very different. So that is what we call the small cell lung cancer. And then we have everything else, which is called a non-small cell lung cancer, which again involves a wide variety of cancers. In general, they tend to be not so aggressive, a little more slow growing, and we have a little more time in terms of determining what different treatment options. There's not as much a sense of urgency in trying to treat those cancers as when we see a small cell. Typically, whenever we detect a small cell lung cancer, Dr. Phillips usually calling me on the phone, and then I'm calling Dr. Mondi. We kind of jump on it and move on it very quickly to get those patients evaluated and treated. Small cell cancers are also extremely related closely to cigarette smoking. You're going to hear this word cigarette smoking multiple times during this entire presentation, because that is a very, very relevant risk factor. So these small cell or the aggressive cancers are almost exclusively seen in smokers. We very rarely see them in non-smokers, so that is yet another important distinction. The non-small cell lung cancers, unfortunately, can be seen even in non-smokers, in younger people. non-smokers who tell us, why did I get lung cancer? I'm not a smoker. Those are the cancers that we see in non-smokers.
Thank you very much. I believe this is probably to you, Dr. Mondi. Once a patient is diagnosed, what are the treatment options? I know there's a lot of factors. We're going to be talking in general here. What are those factors that determine treatment? And what is the role of radiation therapy and advancements in treatment?
Okay. So let me see if this doesn't clip out. Is it? Okay. It depends on what type of, it depends on which way you handle treatment. Stage 3 and stage 4. Stage 1 cancers basically mean it's confined to the lung tissue itself. If it's a stage 2, it usually means that one of the adjacent lymph nodes next to a mass involved a bronchial node. It's a little more peripheral. And stage 1 and 2, if it's non-small cell cancer, those are actually resectable. So surgery is always the best option for stage 1, stage 2, as long as the patient doesn't have severe COPD that prohibits them from, having a part of their lobe removed. Okay, and then stage 3 typically means that the lymph nodes in the middle of the chest are involved also, and that's basically considered unresectable. Curable as it hasn't spread outside to a distant organ. So stage 3 disease is always treated with chemo and radiation together. So Dr. Dar and myself do that. And the radiation is typically about 6.5 weeks of radiation, and the chemotherapy is typically gives for non-small cell cancer patients. And stage 4 spread, and that's treated with chemotherapy and now, more importantly, immunotherapy. Dr. Shadar can talk a little bit about that. But we're seeing patients live with stage 4 disease for years. Amazing. To live. If you want to live, but now with the immunotherapy going on for years and years, so it's pretty amazing. So that's how you kind of handle the non-small cell lung cancers, which make up about 75% of all lung cancer. The small cell, which is the more aggressive one, is about 15% or so, 15 to 20% of lung cancers. That's treated completely different. You're just hoping it's confined to the chest cavity. Most of them are coming up with like stage 3, we call it limited disease. And with that, always not. So that's a very important distinction. Chemo in quickly because the cells tend to break off and spread somewhere else. So that's how those two are handled. Now, as far as radiation has been very exciting lately in the last several years. It used to be that stage 1 and stage 1 lung cancer is just confined to the lung itself and not to any lymph nodes. Was always, if you didn't have surgery, then you were in trouble. Because then when we do traditional radiation, it doesn't work very well at all. Okay, so they came out with something called SBRT, which is stereotactic body radiation therapy, which is delivering a very high dose of conformal radiation to the tumor to almost eliminate it surgically, but it's non-invasive. So instead of 6.5 weeks of radiation, you get your treatment in 3 to 5 treatments. And the success rate in stage 1 disease is pretty amazing. Without surgery, it's about 85% cure rate. And when you do surgery, you're talking about 85 to 90%. So it's very close. But in this community, what we try to do is, and Dr. Mohan will let us know with the pulmonary function testing on the patient, if they're a surgical candidate or not, if they can tolerate it. So what we see a lot in this community is people that have, some of them have stage 1 disease, but they're not at all surgical candidates because they can't tolerate a part of their lung removed. So with this SBRT, it provides an excellent option for them to still give them a similar cure rate, and there's no recovery. There's no really minimal side effects with that treatment. So it's a fantastic innovation, SBRT, and that tumor is moving in the lung, right, when you breathe up and down. So when we target it, Dr. Mohan I'm sorry, Dr. Phillip puts in these gold tracking markers, fiducial markers around the tumor, 3 markers. And so when we do the radiation, we can see exactly where it is and how it's moving. So right before we treat that patient, we image them, boom, it's like a bullseye. It's like hitting the bullseye every time. In the old days, it used to be like, let's put a big margin around it. But now it's very precise and accurate with the markers and guidance. So
Thank you, Dr. Mondi. Appreciate that. That's amazing. Good to hear good news in the. Along those lines, Dr. Phillip, would you talk about screening? And Dr. Armani brought up the point. We have some great technology at Hunt Regional. Can you talk about that technology that we have? I think we have brand new software just installed. So.
Right. So lung cancer screening is basically searching for lung cancer in people who have no symptoms of lung cancer. So the unfortunate thing with lung cancer is most people don't have any symptoms until it's far advanced. So most of the time, after they are way beyond any possibility of surgery or curative therapy. So the screening, they did studies comparing just doing x-rays once a year to CT scans, or what they call low-dose CT scans once a year, and they found that it's decreased the death of dying from lung cancer by about 20%. So that's a big improvement. So there's a small risk of increased from the radiation of a regular CAT scan. So they decided to use low radiation CT, which is about 1/5 the radiation dose of a regular CT. So the criteria for doing lung cancer screening with that low dose CT is people who have smoked at least 30 pack years, which is 2 packs a day for 15 years, or a pack a day for 30 years. That plus somebody who's between the age of 55 and 75 and in good health. And what they mean by that is somebody who's able to go through the treatments needed for treatments with curative intent, either SBRT or surgery. So those are the ones we look for, and we can find cancers that are very small early in the process. So what the new equipment Francis was talking about is navigational guidance. So when we do a scope, most of the time the scope goes about maybe a in. Beyond that, we cannot see the lesion. So the navigational guidance helps us. It's kind of like a GPS unit that you use in your car. It guides the biopsy forceps to exactly where the spot is so that we can biopsy lesions 2 centimeters, nowadays even 1 centimeter. So the new updated software and hardware that we have allows us to be more accurate, so we can even go after lesions that are a centimeter and still have pretty good success with it. So that's where we are as far as lung cancer screening is concerned.
Dr. Sridhar, Dr. Mondi mentioned some therapy, I believe, that we wanted to come back and address with you.
So Imandi was talking about was something called immunotherapy. Most of us are familiar with something called chemotherapy. We've all heard about chemotherapy, and we've all had friends and family who've gone through chemotherapy, if not for lung cancer, for a variety of other cancers. But in general, where we're moving with cancer treatments in general, not just for lung, but for a variety of cancers, is what we're trying to do is look at not all lung cancers as one and treat them as one type of cancer, but we're trying to go and look into what does your cancer look like, what is the specific genetic sequence or markers that are present in your particular cancer, and how can we target the treatment directly to your particular type of cancer as opposed to treating all cancers as one. And why this is important is chemotherapy is almost like shooting in the dark. You're just going to kill cancer cells. Along with that, we're also going to be killing the normal cells that are in our part of our body, and that is what causes a lot of the side effects that people see from chemotherapy is because of all the damage it does to some of the normal growing tissues of our body. So To try to make that a little bit easier in terms of side effects for our patients, what we're now trying to do is we're trying to identify specific targets on their cancer cells and try to see if we can develop a drug specific to that particular target as opposed to hitting all cells. So what that makes it, Dr. Mandi was just saying that we now see stage 4 lung cancer patients surviving for much longer periods of time. It allows us to treat patients with much lesser toxicity or side effects, so they're able to continue their treatments for a much longer period of time. Unlike with chemo, which after a certain point, everybody has certain side effects or toxicities that prevent us from kind of keep going. So immunotherapy is something that we're very excited about, and the good part is there is some form of immunotherapies that are even now available as pills. So historically, we've thought of chemo and immunotherapies as mostly intravenous treatments where you go to the cancer center, sit there for hours for an infusion. Many types of immunotherapies are now available as pills, and it's amazing to see some patients that are stage 4 lung cancer that are just taking a pill at home and are able to manage their disease. We just have currently a 40-year-old non-smoker who we have on immunotherapy for at least 2 to 2.5 years now, which honestly we could not have even hoped for even as early as 5 years ago. So I think immunotherapy in general is a very exciting treatment option that we're able to do for our patients locally. And in the past, we did not have that locally, and patients had to go to different centers, like in Dallas, but we have been able to do that here in our center for our patients. So we're very excited about that.
Along those lines with the immunotherapy, what about genetic testing? I know there's a lot involved around breast cancer, and is that applicable to lung health as well?
Yes, in general, lung cancers are a little different than breast or colon or uterus or ovarian cancers, which tend to have a strong genetic predisposition. Historically, we don't think of lung cancers as more of a genetic disease. They typically are not part of any genetic syndrome. Like I said before, the biggest risk factor for developing lung cancer is cigarette smoking, which accounts for more than 90% of lung cancers. So it's only about 10% of cancers detected in the lung that are non-smoking related. So genetically, there's not a whole lot of imprint that we're able to track because it's more dependent on what environmentally you expose your lungs to than what you're born with. That being said, lung cancers we typically think of as just cancers that start in the lung. We also need to know that there's a variety of cancers that start elsewhere in your body and go to the lung. So those are called metastatic cancers to the lung. And depending on where that came from, that certainly has a genetic predisposition. We also see some other rare types of lung malignancies called carcinoids, which are very rare, but those can be sometimes part of some genetic disorders. But since they're so rare and few and far between, we don't apply any routine genetic screening for lung cancer the way we do for breast cancers. For lung cancers, the number 1, 2, and 3 causes, risk factors is going to be cigarette smoking. So if there's anything you want to take home from this event today is to either stop smoking or cut back on smoking or avoid secondhand smoking of any sort.
Thank you. I have one more question that I'm going to ask, and I'll let y'all fight it out. We've talked a lot about cigarette smoking and secondhand smoke. There's something new in the world today, and this audience may not be as familiar with it, but it's very popular with our kids, I know. Vaping and those type of products, again, very new, but I'm sure you guys have some input as to.
Yes, so vaping. Yeah, so vaping, as I'm sure all of you know, is a electronic way of smoking. Those cigarettes have liquid nicotine filled in them, and they don't have necessarily the smoke coming out, but they still have nicotine. And in fact, one of our concerns with electronic cigarettes is that they can sometimes have even a higher concentration of nicotine than available in a regular cigarette. So, because that is something that can titrate. So people seem to think that electronic cigarettes are much safer. In some ways they can be, in that if one gradually decreases the amount of nicotine in them, then they can be somewhat safer from a lung cancer perspective than traditional cigarettes or cigars. But they still have a lot of the cardiovascular risk factors, the peripheral vascular risk factors, and more importantly, we are seeing some, and Dr. Phillip may be able to expand a little bit more, there are specific lung conditions that we're seeing in these younger adults who are vaping as well. The other thing, what we don't know, is whether vaping causes the same amount of risk as cigarettes, because we just don't have that kind of long-term data. We have cigarette smoking data for going back decades. Electronic cigarettes haven't been around that long for us to know what the long-term implications of electronic cigarette smoking might be. In general, I think the best fit for an electronic cigarette would be somebody who is using it as a way to quit smoking. I would hate to say, if they're going to replace one with the other, that's going to offer any long-term benefits.
Dr. Phillip, along those lines with the vaping, are there things that you're seeing in your office that aren't necessarily the cancer markers or the cancer symptoms, but conditions that you're seing?
I can't say issues with vaping in my office, but I think we've heard on the news the issue of acute respiratory failure and severe lung illness. Those have been linked to some degree, people adding illegal drugs to the concoction that they put in with the nicotine, and possibly containing vitamin E. Somehow they use that to cut the drugs, and those have been related to shown to be possibly causing this severe lung disease that we see in the teenagers. Other than that, at this point, a lot of the, since there is no smoke involved, there is possibly less risk of long-term lung damage. But again, some of these e-cigarettes do contain things like formaldehyde and stuff, which can damage the lung, which can increase your risk of lung cancer. And I think if you look at the American, I believe it's the American Cancer Society, they do make a mention that the FDA did look into some of these e-cigarettes, and this was a few years back, and some of the samples they tested did contain multiple carcinogens. So it's not a safe alternative, and like Dr. Sridhara said, if you're using that as a way to quit smoking and you quit in a few months, it may be better. We're not sure, but yeah. So it's not something you want to do long term.
So we're not encouraging smoking, and we're not encouraging vaping, absolutely. Is there anything that I've missed in my questions that you feel is important to share with an audience like we have here tonight? Anyone?
The message is don't smoke. And if you know people who smoke, make them quit.
You heard it here.
Well, also, like what you said, the secondhand smoke, I have patients like, oh, I can't quit because my husband smokes all the time, or I have to go smoke outside. So, if your spouse is smoking and you're not, they're kind of putting you at risk as well, because they bring that stuff back in the house. I don't want to cause a divorce or anything, but, it's your health.
Family doctor, since I treat a lot of children, sometimes parents don't think about what they're exposing their children to. And we routinely ask on our well-child checks if the child is exposed to smoke. And a lot of adults do not smoke in the home. but they don't think about the car. And these kids are stuck in a car with people who are smoking. And it's causing tremendous harm to those young children's lungs. And we see a lot of asthma flare-ups and children who are getting sick with pneumonia and other kinds of infections because they're exposed to smoke. So I would encourage also that if you have young ones in your life, whether they're your children, grandchildren, or nieces, nephews, that you try to make their environment safe so that they're not exposed to smoke as well.
One more thing in general, it has nothing to do specifically with lung cancer, but you did mention the COVID-19 situation. So it can be very frustrating during these times with the pandemic going on for patients sometimes to differentiate what their symptoms might be and what it's from. There's also been a little bit of resistance seeking out medical care because sometimes patients are worried. Is it safe to go to a doctor's office? Is it safe to go to a hospital? Is it safe to have an x-ray? So in general, I think it can be sometimes confusing, but do not ignore your symptoms. If you have any lung issues, do not assume they're COVID, and do not assume that that could be something you cannot have safely treated. For the most part, we have with the hospital, the Hunt Regional, and I'm sure with most of our primary care physicians, our pulmonologists, and we at the Cancer Center, we've made tremendous changes to our workflows, to our the way we're doing things, to be able to provide effective screening, treatments for all kinds of cancers and illnesses. So it is still safe to go see your doctor. So what I'm saying is if you have a symptom, be open to discussing that with your provider. They will be able to navigate you better as to what can be done, and a variety of tests and procedures are still being done very safely during the pandemic as well. So basically, don't let the pandemic deter you from exploring symptoms if you do have them.
So all screenings are important now, and we're doing those as safely as we can, so please don't put those off. Dr. Lay and Dr. Phillip, can you talk a little bit more about what you see in your offices from an asthma perspective, and is it environmental? What are the things that we can do to encourage lung health in that area?
Well, from an asthma perspective, the biggest problem I see is a lack of compliance with medications. Most people, they feel good for a little while, they stop the inhalers, and then get back to it when they start sick. The problem is every time that happens, you're causing a little more damage to your lung, and there have been people who, over time with untreated asthma, because of the scarring that shows up in the lung, they develop COPD. So compliance is important, avoiding all the irritants like cigarette smoke, any kind of smoke, vaping, especially in the young, is extremely important. If you have allergies, treat your allergies before they become worse and can exacerbate your asthma. There are other things like acid reflux, which can exacerbate your asthma. Generally, a good healthy lifestyle, weight has been known to exacerbate asthma. So if you are overweight, try to get some help losing weight, because that will help with asthma control. Exercise, like always come back to this, but for lung health, exercise is always important. The more sedentary you are, the poorer you do. Obviously, and the flu season is here. Get your flu shots. If you haven't updated your pneumonia vaccine, get that updated. So those are some of the things that you can do to improve asthma health.
Dr. Lay?
I think the other risks in my mind were sometimes pets can be a trigger. So especially cats, and I love cats. I have cats, but think about animals as being a trigger. Dust mites can be a trigger for some people. So I think be aware of environmental exposures, changes in temperature. For some people, hot weather is a trigger. Other people, it's cold. Sometimes it's a change in weather. And I usually tell people the rule of two. If people have to use their rescue inhaler, which is usually albuterol, Provenol, or their nebulizer treatment more than twice a week, then it's time to let us know so that we can try to address their asthma before it becomes worse and talk about preventive medicine.
So along the preventative line for lung health, Dr. Phillip talked about exercising, weight loss. Are there other recommendations that any of you would have for that? For those of us looking for another option? No. Sorry? The shortcut
Yeah.
method, absolutely. No, I do have a question, if one of you will be so kind as to answer. We have pulmonary and cardiac rehab at Hunt Regional. How often do you send patients for those services, and how effective are they?
We do, that's recommended for COPD, pulmonary fibrosis, pulmonary hypertension. They do work. Again, the idea is to get you up and moving, improve your stamina, improve your overall health, and that way your muscles are stronger, so your shortness of breath gets better. It unfortunately does not improve the lung function per se, but it improves everything around it, so you're able to function more. So quality of life is what they're trying to improve, and that's the main reason behind pulmonary rehab. You could say the same for cardiac rehab. It's recommended right after, if you have had a cardiac event, if you have had cardiac surgery, it's recommended, again, because it's been shown to improve mortality and also shown to decrease the risk of a recurrent event. So.
Along those same lines, with Dr. Phillip was talking about pulmonary cardiac rehab, which can be very effective, especially in some of our patients who are recovering from cancer treatment, like they've gone through 6 weeks of radiation, they have some decrease in lung function, they're fatigued after their chemotherapy treatment. So going through a rehab program like that can be very effective in assisting in their recovery from some of these treatments. Along the same lines, we also have, or I would say used to have, it's probably on pause right now due to the pandemic, but we also had a very wonderful program called Fit Steps for Life, which was basically an exercise program that was free for all our cancer patients and their caregivers, and was specifically designed for cancer patients, not lung cancer, but really any type of cancer patient, to help recover after their illness. So these kind of programs, I think they have a lot of benefit, because many of us need motivation. We need an instructor, we need a class, we need to be publicly humiliated before we can actually do something. So if you see a friend doing those reps, you're more likely to do that. So those programs go a long way in getting us moving, especially for some of us that, can't do it alone. And there's also another wonderful thing in some of these programs, is that it brings a lot of people together that have similar conditions, and it is a great way of kind of forming an in-house support group. People share their experiences, especially with Fit Steps for Life. We've seen people come together, they enjoy the group, they enjoy the instructor. So it also builds a sense of community for those patients. So yeah, it's wonderful. So I think it's again a reminder for all of us to use those programs as effectively as we can.
Thank you so much. Thank you to all. Yes.
Echoing the exercise and diet and fitness is very important too, because a lot of us have comorbidities like diabetes, and I've seen patients, they lose like 20 pounds, all of a sudden they don't need insulin anymore. That's amazing, how you can fix that yourself. And not to mention the most important part too is stress relief. Everybody's under stress now with the pandemic, right? I mean, when you do exercise, you'll be surprised. Just even going for a walk outside, 10 minutes a day, 15 minutes a day, increase it, and then you'll start to feel better about yourself and, relieve the stress. And, for those, right now you can't go to the gyms and all that stuff, but if you have streaming on your iPad or something, there's plenty of exercise routines you can look for free on there to follow along with the instructor and just do in your house. Even just doing simple yoga. Oh my gosh, if you stretch for 10 minutes every day, just quietly, you'll feel a lot better. So I think there's things you could do at home now, even though we have this whole pandemic going on. It's important.
We so appreciate all of the physicians giving their time tonight for certain. We hope that you have all had some enlightenment to lung health, and we all encourage you to get your screenings, stay healthy, work out, lose some weight, eat right, get your screenings, stop smoking. Absolutely, stop smoking.